We are live.
Hello.
Jennifer Abel, Dr. Jennifer Abel, a good friend of mine. How are you tonight?
I'm good. How are you, Dr. Patrick McGrath?
Oh, I'm doing wonderful. Thank you. For those of you in the No CD world, welcome once again to our Wednesday night webinar here with No CD. With us tonight is Dr. Jennifer Abel out of St. Louis. Jennifer, I can't. I've been
Jenna Fart.
Jennifarty, farty fart. Yeah. Jennifer is one of my oldest psychology friends. Not that you're old, Jennifer, let me just say.
Oh, yes, I am.
But we have known each other for all of my career, basically, since I did my postdoc in St. Louis. And you were one of the first, outside of where I was working, psychologists that I met. And we have been buds ever since. So good to see you.
You too.
Thank you. For those of you tonight, No CD is sponsoring this. No CD is a downloadable free app for obsessive compulsive disorder. And on the other side of Jennifer, over there, through her ears, yes, there you go, you have a link there where you can link up for a free 15-minute call with our care team to see if a assessment with the No CD therapist might be appropriate for you. And please remember that we are in 23 states right now, so you may very well have a No CD therapist who's available for you, and we continue to grow our insurance networks to be able to take insurance as well too. So, now, Jennifer, so good to see you. Thank you for being with us tonight. And Jennifer, you happen to have an area of specialty that I think is going to be very interesting tonight to all of our friends who are listening, and that is worry. You are kind of like one of the big worry people in the world. Not that, well, maybe that you do worry a lot too in your life. I don't know. I'm able on that, but
I usually practice what I preach.
That's good. But you have definitely spoken all over the world and written all sorts of wonderful books and done trainings for therapists all over the country and Australia, I know, on worry. And I thought, what a great thing it would be to have you here tonight, because a couple of things, and then we'll get into some discussion here. But I know that a lot of people with obsessive compulsive disorder get misdiagnosed as being worriers. Oh, you're just worrying about that, and GAD becomes the catch-all for any anxiety disorder. And sometimes you just go to a physician and have you been worrying much? Yeah. Oh, well, you've got generalized anxiety disorder. So I'd love for you to kind of talk to us about what is worry, what is GAD, right? And for us to kind of take a look at what's the relationships with that and OCD, and what are the therapies and the crossovers. And over time, I'll kind of monitor too if we get some chat questions as we're going along, and I'll throw some of those out and we can kind of attack those. But I'd like to turn it over to you first to kind of give us some education on worry and what's its effects on our brain and our body, and how we deal with things and function in life, and are there better ways to do things than worry about them, and all that. So the
exactly, of course, problem solve. Don't worry, problem solve.
That's what I love. That's what I say. Yeah.
Worry is useless. Problem solving can be helpful. And I think that, I was thinking about, what are the differences? And oftentimes it's very clear that this is a worry and this is an obsession. And sometimes, and I think the time that I get more confused about, which one is this, is when it does come to things like COVID-19. When people get into, and not just COVID-19, but hypochondriasis in general.
Yeah.
And that's where I think sometimes you get this mishmash of, this is kind of a hybrid, if you will. But I think of worry as a lot of times people worry because they feel like they're trying to solve a problem. Michelle Newman has talked about contrast avoidance, where people with worry would rather be constantly anxious than be caught off guard. And so they would rather be in this chronic state of discomfort than to be caught completely off guard. You might say that they think that suspense is better than surprise, whereas most of us think that surprise is better than suspense. And interestingly, we see this in the physiological data. And to put it in layman's terms for our viewers tonight, is that worry tends to be this, that we see that they're in this, they have a hard time being able to relax, rather than these huge spikes of anxiety that we often see with OCD when people are obsessing. And I think that, we look at the nature of worry is people worry about their children, people worry about money, worry what people think of them. Those tend to be more worries, whereas OCD, and you might be better at describing how OCD differs, but it's I'm afraid that I'm contaminated, or I'm afraid that I didn't check things right, or forgive me for saying some kind of odd beliefs. More, when we get into these odd thoughts, they tend to be fall more into the camp of obsessions.
Yeah. So a worry then doesn't have a associated compulsion. Worry seems to make more worry.
Exactly.
Okay.
Now, that doesn't mean, though, that people who worry don't check things.
Sure.
But it's not to, the extent. So someone might say, gosh, I'm really worried that I didn't check the door. Did I leave it unlocked? And they go and they look at it and they go, oh, okay, I did. And then they probably won't worry about that anymore. Whereas someone with OCD may feel compelled to count and check it, a certain number of times. People who just have worry don't do that, like counting and checking a certain number of times, or check it and then still question, did I check that?
Right.
But I think one of the most important things to delineate here is in how we, you asked me to talk a little bit about the nature of worry. And worry tends to come first. Worries and generalized anxiety disorder, which we might call the worry disorder, is one of the most common comorbid conditions amongst the anxiety and mood disorders. So if someone has more than one anxiety disorder, they're depressed and they have an anxiety disorder or two, very commonly worry comes first and tends to put people at risk for developing OCD and panic attacks and depression later on in life. And I would say that with all of the anxiety disorder, I know that Dr. McGrath is a big exposure person. Exposure. Do exposure for every anxiety disorder. It'll cure every anxiety disorder. And I agree with that when it comes to panic attacks, when it comes to phobias, when it comes to OCD, when it comes to PTSD. But worry, not that I don't encourage exposure,
because there's an element of it, sure, but there's
because
other
I do think that worriers are already repeatedly worrying the same worries over and over again, which is one of the similarities it shares with obsessions. But relaxation and cognitive therapy, I wouldn't suggest for OCD. I don't think OCD responds, and I think the data show that OCD doesn't respond well to cognitive therapy, and it doesn't respond well to relaxation therapy. And whereas worry does, but we need to catch it early, and we want to use relaxation frequently. And the idea is nip it in the bud, catch it early. And I think more of the exposure area with worry is where we allow and accept the feelings. So we allow the feelings to be there. We allow the worries to be there. We don't try to fight those worries. And I think that's one place that we're similar with OCD.
I like what you said earlier, and I think it's very interesting. You said suspense versus surprise. And so if I'm always in suspense and I'm always worried about something, then you said I won't get caught off guard, right? And OCD plays a similar role in some ways. If I constantly remind you about something bad that will happen, then I can keep you on guard about it. And as long as you keep doing the rituals after you think that thing, that will stop the thing from happening. So there's an interesting parallel there that I really, but it doesn't, right? But very interesting parallel there that I really like. Yeah, I remember seeing Tom Borkovec, who you may know. I don't know if you've ever heard of Tom Borkovec. But Tom did
I
I
worked
loved
with
it.
him for a couple of years.
You might have, yeah. I loved his visual of if this is calm and this is anxious. He did this at a talk one time. I thought it was really cool. And he said, if you're calm and something bad happens, you jump from here to here. But if you're already anxious and worried about it, and then it happens, well, now you just jump from here to here. That worry is trying to get you ready for something just in case. And it's hard to live up here. I mean, that's like revving your engine constantly all day long, just in case this bad thing's going to occur. So what's it like on the brain and on the body for people who experience this kind of chronic worry all the time?
Well, we see a lot more medical problems with people who worry chronically, particularly GI symptoms. People with GAD are 4.7 times more likely to suffer from irritable bowel syndrome. People with irritable bowel syndrome are 5 times more likely to suffer from GAD. But even cardiovascular disease, and like I said, it puts people at risk for panic attacks. We see skin disorders. We see lowered immune function. And finally, some skin disorders that people are likely to and headaches. Headaches are very common.
Really?
Tension headaches, yes.
Wow. Okay.
Because, when people worry, they get tense. And one of the symptoms of GAD is muscle tension, and another one is insomnia.
Yeah. Yeah, I remember, and I tell this story a lot in talks. I was 16 years old, driving my parents' Delta 88 Oldsmobile around the city of Chicago, and I would come home, and my dad would say, "Is the car okay?" I'd say, "Yeah, it's fine." And my mom would say, "Are you okay?" And I'd say, "Yes, I'm fine." And then she'd say, "Well, see, it's a good thing that I was worrying about you." There's like a
superstitious belief.
Yeah, there's a magical,
which we see in OCD even
yeah.
more.
So there's another commonality really between the two of them. Had I not been worrying about you, you probably would have been in a car accident, but maybe it was my worry that helped you or something. Do you see that a lot with people?
Yes. And I think, here's the thing is that with things like COVID-19, with children being abducted, with the school shootings, of course, people aren't worried as much about school shootings right now, at least. Terrorist attacks. It certainly makes sense that we want to be able to control these things. And I believe that worry gives people a false sense of control.
Yeah.
And most times I ask people, if a horrible thing happens to you, will you be glad that you worried about it? Most people say no.
Right.
And then my response to that is then, anytime you start to think about this, postpone your worry to if and when it happens. Now, some people say, oh yeah, I will be glad because of that contrast avoidance. I'm going to be prepared for it because I'm up here. You're going to be here. You haven't worried about it. So it's going to catch you way more off guard if it happens. Well, first of all, I say, that's a terrible way to live. And you're betting your emotions on a losing outcome, on an outcome that's not likely to happen. And even if something bad does happen, it's rarely how we, it's never exactly how we think it is.
Never.
It's going to be.
Yeah.
But I have a solution even for those folks. And that is worry about it, but you control when and how long you worry about it. Now, usually at least before COVID-19, people have a commute. I would say worry about it on your commute. Every morning on your commute, Monday through Friday, worry about all the horrible things that could happen. And then when you get to work, or if you have a really long commute, like, more than 20 minutes, and you'd want to do it for at least 10, when you turn off that exit, then you say, okay, that's it. Or when you get to work, that's it. Anytime that I start to worry about these horrible, awful things happening, I'll remind myself, I'm not going to worry about that right now. I'm going to worry about that. tomorrow morning. Then they've done their due diligence. They've worried about it. Then they're not going to be caught off guard. And this works. This has worked.
Yeah.
I mean, I've probably only had, 6, 7 people like that, but it's worked every single time.
And I've seen that work too. And I think that's one very big difference between OCD, because someone with OCD isn't shutting off that kind of constant thing versus the person with worry has the ability to say, well, I've done my worrying for today. Now I can move on to some other things. So, which reminds, since we said that, by the way, everyone, welcome to the No CD Wednesday night webinar. Our guest is Dr. Jennifer Abel, extraordinaire out of St. Louis. And reminder to all of you, the No CD app is available to you free on iOS and on the Google Play Store. And should you need some OCD teletherapy, we're available for that in 23 states right now and working on getting more and more insurance coverage every single day for that. And you can go to treatmyocd.com, or you can also go over to the blue link over there, and you can click on that as well for a free 15-minute call with our therapy care team. And then if it looks like OCD might be something going on, we'll set you up for a diagnostic evaluation with one of our therapists. So check that out. Now, Jennifer, I'm wondering, for people who have OCD and generalized anxiety disorder. Trickier, yeah, very tricky. But I know that you have done some excellent work in kind of training with relaxation and everything. So I'm wondering, for the worriers that are listening, because we know there's people, everyone here probably has OCD or is a family member, but we also know that there's some non-OCD worries that they might be experiencing as well too. So to separate away from the OCD piece and just to look at worries, could you kind of walk us through maybe an exercise that we can do, or
absolutely
a way to do like a relaxation or something of how we could all deal with a worry? I'd love to kind of get a live experience of that.
Okay. All right. So what I'd like for all of you to do is to think about where you feel anxiety in your body when you feel it, whether it's from your OCD or whether it's from your general anxiety that stems from worry. And I'd like for you to think about where do you feel it in your body, and closing your eyes and focusing on that place in your body and noticing how you feel when I say these words. Calm down. Calm. Calming. Calming. Calm. Calm down. And open your eyes. Anyone ever tell you to calm down and you want to flip them off?
Yeah.
Or they tell you relax and you get more anxious? These are commands, and we tell ourselves these commands all the time, like chill out, let it go. So we respond better to these words that are process words and states words.
Okay.
So we'll take this a step further, and closing your eyes and noticing how you feel when I say these words. Releasing, soothing, softening. Which one felt the best? And playing with some of these words. In my workbook, I have people go through 9 different process words and 9 different states words, and you can create your own, So if you typically tell yourself, breathe, just breathe, instead try using the word breathing. Or if you tell yourself, just relax, instead think relaxing, relaxed, more relaxed. And ask other people with whom you spend a lot of time with. Honey, instead of telling me to chill out, can you please use my favorite process word, soothing? And then when people say those words, do it. Another, muscles. We feel muscles from head to toe. So and if you think about it, if you walk around, even 10% of that, it's going to make you tired
Sure.
and make your muscles ache by the end of the day.
Mm-hmm.
So simply just letting go of any tension in your body that you don't need and being mindful of letting go of any tension in your body that you don't need
Mm-hmm.
can be helpful. But we can take that a step further. It turns out that we can get our muscles more relaxed if we tense them first. So you can either think of being an uncooked noodle, or and make your body as hard as possible, but never want to make it cause pain. You probably don't want to tense as hard as possible, about 80%.
Okay.
And then become a cooked noodle, or because I like the Wizard of Oz, and it's the one that I came up with, the idea that I came up with. I think, think like a Tin Man, not Superman, the Man of Steel, where you're going to feel as you're going to tense as hard as possible and maybe hurt yourself. Then think more like 80%, do the Tin Man. So if you'd like to do this with me right now, go ahead and tense all the muscles in your body, not just quite yet, by pulling up your feet off the ground, pulling your toes towards your shin, making muscles with your fist, pulling your shoulders back and down and tensing to your side and making a face. So ready, set, Tin Man now, and bend your neck too. And feel the tension in your body. Notice how it feels, and releasing, letting go. Noticing the difference, thinking of being a scarecrow. Loose, limp muscles, no joints, floppy, loose, relaxed. Making no effort, just noticing the difference between how your muscles feel now as compared to before. And then I have visuals of imagining the surfaces beneath you are like a sponge. And what I really like to do is, because, I was mentioning in the physiological data, for those of you who do have a background and understand, people with generalized anxiety disorder have an inactive parasympathetic nervous system. It's more of a matter of they can't click into that calm down nervous system, rather than that they're constantly highly anxious. So what we want to do is get deeply relaxed, or after you go work out, a lot of people say they feel most relaxed after they work out. Maintain that relaxation by creating reminders and doing mini relaxations.
Mm-hmm.
Now, if it's just with worry and the person doesn't have OCD, I recommend cognitive therapy. But I don't play with cognitive therapy if someone has OCD, because because then they start to become compulsions.
Yeah.
So I use more of the physical relaxation. And so if you feel like you are suffering from both a lot of worry and a lot of OCD, and you do decide to get my book or my therapy cards, I would really encourage you to use more of the relaxation tools rather than the cognitive therapy tools, because the cognitive therapy tools may become compulsions by you constantly reassuring yourself.
Yes, and thank you.
That makes sense to you?
Absolutely, and I saw you put some of your books and cards, things in there. So if
Someone
anybody's
had
interested, they're in that. You put them in the chat. So thank you very much.
I'm trying to answer some of these questions.
I do like this one. Speaking of worry, how do you deal with anticipatory anxiety, which for me comes with ahead of doing any task? So that's great, because that's a form of worry, I would say, wouldn't you? Or if I'm wrong, let me know. But anticipatory anxiety. So yeah.
Yes, I mean, it kind of depends, and I do think that sometimes the anticipatory anxiety can help to reduce the anxiety during the event, but you want to minimize that. Mm-hmm. In fact, there was a study that showed that people with test anxiety, if they sat and really focused on their worry about their tests, before the test and took 10 minutes to just write out all their worries and intensely worry about their anxiety, it actually helped their anxiety during the test.
Mm-hmm.
So sometimes anticipatory anxiety is helpful. One of the things I really like to do, and I don't know, Patrick, if you think this with OCD, I think it's safe, is I like to think of, is this feeling useful or useless?
Yeah.
So if I have this anticipatory anxiety, is this feeling useful or useless?
Mm-hmm.
I use this in traffic all the time. Well, traffic hasn't been as bad, but
yeah.
I used to use this in traffic all the time. I get annoyed with, I was like, useless. And just reminding myself that this feeling was useless helped me to let it go. Wanted or unwanted. Do I want this feeling? No. And, you might even, with the anticipatory anxiety, is there anything that I can do to prepare? Because I truly believe that worry is 100% useless, but problem solving and planning is helpful. And we can plan and problem solve with or without anxiety.
Right. And I say the same phrase all the time. Problem solving's better. I'll throw my little board. I always like the Yerkes-Dobson law idea and kind of what you were talking about, that studies since 1918 have showed that people with low and high anticipatory anxiety do equally poor in performance, but it's people who have kind of that middle ground who actually seem to do the best. So it's not that you or I are here to say that anxiety is bad, because it's not. It's actually a good thing in many situations. It can be helpful, but we would both agree too much of a good thing is bad, right? So, and not enough of a good thing can be interfering as well too.
Yeah, there was for those of you who watch Big Bang, there was a Big Bang episode where Sheldon said, I have to have some anxiety. I have to have the right amount of anxiety. Mm-hmm. But even there, I believe that it's the Yerkes-Dodson is a moderate amount of arousal.
Yeah.
And that if we have a moderate amount of arousal that is fueled by motivation, curiosity, and motivation, we'll just say, because I can't think of the other ones right now. We don't necessarily need to be anxious, but anxiety can sometimes be useful in helping us to get out of a dangerous situation.
Mm-hmm.
And in those cases, we're not worrying, we're reacting.
Yeah. Well, I like the idea too that you talked about, that almost never is the thing that we worry about the thing that actually happens, right? I mean, I've told the story, but I think the most planned day of your life is your wedding day, and more people put more time into planning that day, those couple of hours, than probably almost any other day of their life. And I still haven't been to a wedding where something didn't go wrong. And never was it the thing they planned, like someone falling off of a bench in the middle of a ceremony, or Uncle Jim did too many shots and broke his leg thinking that he could dance like all the 18-year-olds and he's 70, and so did we not worry enough, or could we never worry enough? Maybe is the good question. I don't know that there's ever enough worries to have to anticipate any possible thing. And therefore, there's your useless comment. If we can't think of every bad thing that might happen, do we need to spend all the time trying to? Or is that just a waste of time, right?
Yeah, an interesting story of a woman. I didn't see this woman, a colleague of mine did, who worried and worried and worried and worried all the time. And one day she came home and her house was on fire and it burned to the ground. And she said, you know what? I never worried about that. Mm-hmm. And it cured her worry. Yeah. Well, I shouldn't say cured her worry, but she said, I hardly worry about anything anymore. Yeah. Because I realized that I think that worry is oftentimes a way to try to control things that we cannot control. Mm-hmm. So now I see a lot of people asking questions about OCD, and
which we're going to have here at NoCD. By the way, welcome to the Wednesday night NoCD webinar, everybody. Brought to you by NoCD, a free downloadable app available to you through the iOS or Google Play Store. Also, we have a teletherapy service, and that teletherapy service is available to you in 23 different states currently. If you're interested in taking a look to see if it might be available to you, you can book a free 15-minute call with our care team. The yellow up in the corner box there with the blue hyperlink, you can click on that, or you can go to treatmyocd.com. So we'll kind of go through then and take a look at some of the questions and OCD things, but I'm also interested, Jennifer, in some of your thoughts too on some of these things as we go through, and maybe take a look at what a worry kind of idea might be for some of these as well too. So let me pick a couple of basic ones. Let's see what we got. So there's something here about religious, spending hours reading the Bible, watching religious movies, researching religion, and how good you feel afterwards, but soon those feelings come rushing back. It's hard to understand why God loves me and if I deserve his love. So a basic kind of scrupulosity type of OCD experience here. And I think, again, we can see some worry that gets involved in that there, Jennifer, where and maybe we take a step before we answer that. I've often said that anxiety and worry are two words, and I'd like to hear your opinion on that. I think those two words are what if, and especially in OCD, are followed by whatever the worst case scenario is that you can think of. But how do you deal with those what if questions with patients that you work with?
Well, I guess it depends on what if.
Yeah.
But for some reason, I'm thinking about panic attacks right now, and that people, might say, well, what if I have a panic attack? And then I want to know, well, what are you afraid is going to happen if you have a panic attack?
Right.
Well, I'm afraid that I'm going to go crazy. Well, what are you afraid is going to happen if you go crazy? Well, I'm afraid that I'm going to get institutionalized, and I'll lose custody of my kids, my ex will get them, and they won't love and respect me ever again. And so I use verbal exposure with that. Then I'm guessing you probably do too.
I would, yeah, absolutely.
So what if, and to just say it over and over and over and over and over and over again until you get bored with it. Because eventually you are going to habituate, or you're going to get comfortable with that discomfort. That's a phrase I like to say, is get comfortable with the discomfort. And I think of that more when I think of panic, but I think it relates to OCD and when people have what if worries too. Yeah. So,
and then I'd even go to, well, let's do interoceptive exposures. Let's create symptoms of panic.
Absolutely.
Sit with that discomfort and allow ourselves to handle that. So I think that the thing here that we see in this question, go ahead, sorry.
I was just going to say, anybody out there who has panic attacks needs to know about interoceptive exposure. It is extraordinarily effective and so much more effective than medication. There are a few outsiders who do well with SSRIs or SNRIs, like Paxil, Zoloft, that type of thing. But over 90% or around 90% of people are completely done with panic attacks from interoceptive exposure, but you want to do it with a therapist who's trained in doing interoceptive exposure.
And for those of you who don't know, interoceptives are purposely creating symptoms of panic one at a time. So running in place, hyperventilating, breathing through straws, spinning in a chair, and allowing yourself to learn that you can handle those sensations. You're really breaking down all the symptoms that could occur during a panic attack and allowing yourself to learn that you can actually handle those symptoms. You don't need to be afraid of those symptoms, because one of the reasons people have panic attacks is they're constantly checking their body to assess if they're having a certain symptom that they're afraid of. And of course, the more that you check your body, the more you might find something that you might be afraid of, which will lead you to have more fears and panic as well, too.
Yes.
And maybe, Jennifer, one other question on that. I've always said we have really noisy bodies, right?
Yes, yes.
Our
And not just
breathing.
flatulence.
Yeah, right. Not just the tooths, but all sorts of things. And all those, either a joint making a sound or a crackle, or that my breathing suddenly I'm hearing, or I'm really feeling my eyes blinking, or my hair feels really heavy, I haven't cut for a while. All of those different things can be things that our anxiety can really latch onto then, and start to focus on about why is that happening. And of course, the more we start thinking that, the more we even focus on it, and it just becomes worse and worse.
It's like, don't think about this blue duck.
Yes. You have a blue duck,
okay.
right?
Now everybody's.
I have my pink elephant. Yeah, there you go. So very good. Yeah. Mm-hmm.
Yes. And the more you try to not think about it, the more you're going to think about it.
Yeah.
And I think that, what I do, because I am the queen of having physical symptoms. I have all kinds of physical symptoms,
Mm-hmm.
I might have an ache on my right side, or I might feel a twinge somewhere, and I just think, well, okay, I'm going to wait and see.
Yeah.
And that symptom may come back the next day, and I just got, I'm going to wait and see. And I'm going to wait and see. And I think that's what most of us who don't have issues with this do. We take a wait and see approach, and 99% of the time, it either goes away and it never comes back, or it goes away and it comes back, and it goes away and it comes back, but it's never a big problem, and then eventually it goes away and it's not a big deal.
And here's with worry, and maybe a commonality that I think we'll cross with OCD. One of the things we try to get with people with OCD, is to be okay with just waiting and seeing and not knowing. And I think that
point.
Probably
really
with worry, we see something too. There's such a problem in anxiety-based disorders for people who have them, with not having a 100% guaranteed answer for something. They want that absolute guaranteed answer for something. And what is your advice for people on being able to sit with not knowing, that we don't have that 100% answer?
Yeah, to just get comfortable with the discomfort. And you have a choice. You can worry about it and worry about it and worry about it, or you can take a wait. I like the wait and see approach. I like the worry postponement. I'm going to think about this. I'll think about this tomorrow, and then follow through with that. Do worry about it tomorrow. I'm having dinner. I'm worrying about work, and I'm having a hard time relaxing because I keep thinking about, what do I need to do with that client? And I don't have this where I'm just saying if I did, that I could say, you know what? I'm going to worry about that on my way into work tomorrow. I'm going to postpone that. And then I'm going to try to problem solve it instead of worrying about it.
Yeah.
And this works extraordinarily well. And then things that people are worried about that are far into the future. A lot of people who have children are worried about, are they going to be expected to go to school in the fall? And are there going to be, differences in what happens if they go to school in the fall? And I say, okay, you know what? Postpone it. Postpone your worries to a week before they're supposed to go back. And anytime you start to think, well, I wonder what's going to happen this school year. I'll think about that. And I have them put a date in their calendar. I'll worry about that on August 18th. And it doesn't mean that it's not going to cross your mind. I mean, we have between 2,000 and 2,100 thoughts per hour. Many of you with OCD and worry may have 3,000 or 4,000. But, even those of us who are healthy, we have, over 2,000 thoughts an hour, which is more than 515 minutes. So sometimes these thoughts are going to cross our mind. So, when they do, you just remind yourself, I'm going to worry about school on August 18th. And then hopefully you won't think about it for as long.
So So back to that question about the religious piece. Yes.
Oh yeah, the religious
Allison,
stuff.
you will feel better when you watch those movies, when you read the Bible and everything like that, because you're seeking reassurance and you're doing a safety behavior at that point. And the best thing that you could do from an exposure and response prevention therapy standpoint would be to sit there and just wonder what's going on instead of watching those things to get that good feeling from it. Allow yourself to be able to sit there and wonder, maybe God's happy with me, maybe not, maybe God loves me, maybe he doesn't, and allow yourself to be okay with that thought. Now, here's the piece with that. Many people will look at that then and say, well, does that mean that I'm okay with God loving me or not loving me? And it's not about that. That is not where we're going here. It's not about that at all. It's about being okay with the thought about that, or the image or the urge about that. That's where we really want to get to. There's this notion that in OCD that thoughts are bad, right? That I should not have a certain thought. I should not have a certain image. I should not have a certain worry. I should not have a certain urge. Those just should not ever be there. And we want people to be able to get to the point of recognizing that they are there. It doesn't mean that I have to do a darn thing about them.
Yeah, I think something that I use with worry very frequently that does help quite a few people with OCD is I'm going to observe my mind. I'm going to close my eyes and I'm going to let any thoughts come into my mind. I'm going to watch. So let's go ahead and try this right now. Watching your thoughts. Don't try to think. Don't try to not think.
Mm-hmm.
Instead, just watching your thoughts, almost like you were watching cars drive down the road or birds flying by, and letting go of any judgments. Now, every thought that you just had was a thought that you've had before I had you close your eyes, or it might have been a new thought. After each thought that you have, if you're alone, label aloud new or repeat, starting now. Expect that most of them will be repeats, and observing and labeling new or repeat. And you can open your eyes. Now, what I find with worry is about 80% of the time that people just say repeat, 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 and they feel the futility of those repetitive thoughts in a way that they haven't felt before that helps them to disengage from them. With worry, I often use useful and not useful. I think it depends. I don't know what you think about that, Patrick, as far as, if people might start to get too analytical about, well, I don't know if that's useful or if that's not useful. But for the pure worriers, that can be really useful to label. Yeah. Or I had one guy say to me, all these thoughts that I have are such bullshit. Mm-hmm. And I said, weren't we using that useful and useless labels? And he said, yeah, but it works a lot of the times. So, but sometimes these bullshit thoughts just keep flying through and they're too much and they overwhelm me. And I said, well, let's start labeling your thoughts as useful and bullshit. Mm-hmm. And he came back, he says, oh my God, that works so much better.
So you got to pick your language.
Yeah, and then Reed Wilson. Is it Reed Wilson? What's it?
Yeah,
is that what I'm thinking of? Yeah.
We know Reed.
Yeah, we know Reed. He's very good. He'll say, name your OCD, mm-hmm. Maybe your OCD is Chuck. Mm-hmm. I'm trying to think, Maybe it's Godzilla. Maybe it's jerk face,
Yeah.
but label each one of your thoughts as there's jerk face talking again. Oh, that's not me. That's jerk face. I don't know. What do you think about that strategy?
Some people do that and find, and I see that more with kids that I do some of that work.
Good. I just saw someone said I had zero thoughts. Excellent. That's what we want. That's what we want. I have some people complain when they watch their thoughts, but I can't think of anything. And I was like, yay, good.
Yeah,
Anyway, I'm sorry. Go ahead.
no, that's fine. I do a lot of that with kids. With adults, I just kind of get more of just accepting the fact that there's a thought there, and that's just what it is. A couple have come across. Omar asked about suicidal OCD and existential and says, I don't hear much about that. Well, there's a ton of it out there. I see it all the time. Now, that being said, there's a lot of, remember, themes for all of you out there. There's a lot of themes about OCD that people don't talk about much. Even Moss has any help with sensory motor OCD. There's think of it this way, especially in the COVID world, what do we hear? We hear about cleaning and contamination. So it's a lot of focus on that. There's some focus on harm as well, too. What if I were to pass on COVID or a contaminant to somebody that I love who might be immunocompromised or something of that nature? Okay, so those have kind of taken over in the media spectrum. We even unfortunately hear a lot of people in the media say, well, maybe it's time for all of us just to have a little OCD right now, which I just get so furious whenever I hear something like that. Can't stand it.
Yeah.
But in terms of like, let's say, what if I were to harm myself, or why are we here? Why do we exist? Or how come I'm focusing on my breathing or my blinking so much these days? And why is it that I can't get that thought out of my head? Sometimes the very thought of why can't I get this thought out of my head becomes the reason why something's in your head, right? And so I try to get people to recognize that the more that you try to figure out why you're having a thought or an image or an urge or a feeling, is the very reason why you're having more thoughts or images or urges or feelings about that thing, right?
Yes.
Yeah. So there's almost this notion that if I could just figure this out, then I will solve it. But these are unfigure-outable things, if that's a word we can use in some ways. And it's not about figuring out. It's just about not caring. So what is sensory motor OCD? Comes along the lines of, hey, sensory motor OCD is really a focus on your body. Like I can't stop thinking about my blinking or my breathing or why my arm feels a certain way when it's in a certain position, or why did I move my hand the way that I did, or something of that nature. Swallowing.
Why are my fingers crossed?
Yes, right. Swallowing is a big one too. Did I swallow it? Breathing, which nostril has more air coming in and out of it, or why did my heart rate go up there, or something like that. Again, trying to figure all of these things out are kind of issues that we might see as well too. So just wanted to kind of call all those things out and get people to recognize those are ways that OCD also presents itself with, as well. They're very common types of things to have these intrusive kinds of thoughts about believing that you have to figure things out and know things, or you have to understand everything. If it's about philosophy or ethics or morals or our body or anything, OCD can jump into all of those kinds of things and really be overwhelming. So
yeah, one of the things I'd like to point out too is that there was an interesting study that showed that more than 90% of people admit to having untoward thoughts come into their minds. And like me, I remember carrying my laptop next to my elderly mother that I love, and I had the thought of bashing her in the head with it. And it didn't bother me because there's one of those thoughts. I have thoughts of picking people off with my car when I'm driving down the road. I have thoughts of jumping into oncoming traffic. And because we have over 2,000 thoughts per hour, some of these random thoughts are going to come into into my mind.
Right.
And, I'm a good person, but I wouldn't say I'm the sweetest person. So if I have those thoughts, I just go, oh, there's one of those thoughts. And I am comfortable with it. But but some of the sweetest, kindest, nicest people are the people who develop OCD because they think, oh my God, I can't believe I had that thought. I got to stop thinking. I got to stop thinking about hitting my mom in the head with my computer. Right. What if I did that? Oh my God, what if I did that? I'm not going to do that.
And
I'm not going to, but what if I do? And that is what feeds it. And there was actually a study, I don't know if you've seen this one, where they took people with these normal worries and they said, okay, like if it was me and I was walking down the road and I had the thought of jumping in front of the car, I said, what if I do it? What if I just jump in front of the car? What if I do it? What if I jump in front of the car? What if I do it? What if I jump in front of the car? And then they had another group of people say, what if I do it? No, I'm not going to do it. What if I do it? No, I'm not going to do it. What if I'm going to do it? No, I'm not going to do it. And those people that did the back and forth, the ping-ponging or the seesawing, they actually had more anxiety. Mm-hmm. And these are normal, healthy individuals that actually started to get some OCD symptoms by trying to fight those thoughts, because you're negatively reinforcing them, and negative reinforcement's a difficult concept to understand. I'm guessing that's something that you explain in No OCD is
with
help
OCD
people to understand negative reinforcement.
Yeah, the removal of aversive stimuli increases behavior. So when I kind of avoid this thing and I feel better, that teaches me to avoid that thing, right? So that's why I continue to do that. When I get reassurance from somebody, it removes my anxiety. So I get more reassurance because it feels better. But
it feels better temporarily and makes it worse in the long run. The very things that people do to try to fight it, actually, while it helps in the short term, it makes it way worse in the long run. Like the person who was saying that they feel better when they're watching a religious movie or when they're praying, but as soon as they stop, they feel worse, and they probably feel worse than they did before they started.
Yeah, exactly. So, it's interesting that, and I'm glad you were here today, and I'll kind of wrap us up here for a little bit, because a lot of people in the OCD community have asked about worry. So I wanted to just definitely have that discussion today about what's a worry and what's the difference with that and maybe an obsession. And, the biggest difference is that an obsession is followed by a compulsion. An obsession is neutralized, and a worry just seems to make more worry is kind of what I see happen as well too. So, but worries and obsessions can both be very disabling to people and can have very negative effects on people's lives. And Jennifer, do you want to just take a moment to kind of talk about what you're doing now in St. Louis and your books and things like that? I'll give you a minute to do that.
Well, I'm not doing anything because actually I am working on a seminar for INR, INR seminars, and it'll be on worry, anxiety, worry, panic, and OCD. And I am really hoping to do a lot of, to develop my own business in doing keynote addresses.
Great.
For a variety of conventions.
Wonderful.
Yes. Well, I'm not writing any books currently.
You're done with the book writing, okay. Well, you've got your book.
Not writing any now. I really want to write a second edition of Active Relaxation. I think Active Relaxation is a very good book, but I think that I can make it better. Mm-hmm. And, we mentioned the postponing worry. I don't have the postponement worry part.
Yeah. Cool.
Can you all talk about urges versus thoughts? That's a good one. So, but we're winding down.
I could real quick, I can get into that. So OCD takes a look at three things: thoughts, images, or urges. So a thought of pushing somebody into a train. an urge to actually go and do that, like that drive. I feel like maybe I turned my body because I wanted to go do it, or the image of actually seeing myself do it. So those would be those three areas, and we treat people for any of those three things that somebody might be experiencing, right?
Yeah. I like the idea of sitting with the urge, feeling the urge, allowing the urge to be there, and just watching the urge.
I agree. Next week, we're going to have with us another guest. We're going to have Dr. Eric Storch with us next week, who is specializer in child and adolescent OCD. So I think that that'll be really interesting. Even if you're an adult and you had your OCD start up as a child, Eric, or as an adolescent, Eric will be here to answer some questions. If you have people in your family who are children and adolescents who have OCD, please feel free to put some questions into the chat as well too. So I think that would be that'll be really helpful for people as we take a deeper dive next week into the more child and adolescent piece of obsessive compulsive disorder. So, as I like to round out always, this has been your NoCD webinar provided to you by NoCD. NoCD is a downloadable free app, and we have a teletherapy service as well in 23 different states. And we have insurance coverage that we continue to work on as well too. Now, remember this, everybody, before we go. And I saw lots of questions tonight, and keep them coming every week. We will get to them. And I just want you to recognize these things. Do the opposite of what your OCD tells you to do. So if your OCD says to you, you really need to focus, I saw one person, on your swallowing. You need to always be paying attention to your swallowing. Why are you swallowing? Are you swallowing the right way? How about this? Just swallow, and who cares how you swallow? Because you've been swallowing since you were born, and for the first 20 or whatever years of your life, you didn't give a crap about swallowing. But then your OCD suddenly said, maybe you could choke, or, well, that swallow felt weird. And now OCD has picked on that thing. So here's what to do. Go back to doing it the way you used to do it before you had OCD, because it never bothered you before you had OCD, and therefore that tells me that you know how to do it. So go back to doing it that way and practice being like that, what it was like to do something prior to your OCD was in your life. And if all of you could do that, because all of you probably, no matter what the type of OCD was, all of you have probably driven in your car and someone cut you off and thought, I'm going to punch you in the face. I know I have, right? All of you have probably been in a mall and seen a screaming child and thought, I'm going to kick you in the head if you don't shut up, right? We've all had those types of thoughts, and prior to OCD, didn't give a crap about them whatsoever. The only difference now is that you have a disorder that makes you doubt and wonder what your intention was, and leads you to believe that the worst case intention you could think of is probably the one that you have, and you better darn well go do something about it to make that not happen, or else you're going to be at fault for it and it's going to be bad on you. Keep those things in mind. We'll see you again next week. Dr. Abel, thank you very much for joining us tonight.
You're welcome. Thanks for those of you who tuned in. I like this, that people are supporting one another, and
yeah, I think it's lovely.
It helps to normalize. It helps to normalize their experience in some way. That, gosh, I have that too. I'm not alone. So that's wonderful. Good luck, everyone.
And Dr. Abel, you've got the kill switch tonight, so if you would hit that little end button, we'll be good to go. Everyone, have a good night.
Take care. Have a good one.